Hi everybody. Now there's many different mental illnesses, but in this video I want to talk about treatment for it, what treatment's best for you, what works for you, and medication. So with the medication, a few years ago, like the medication that was used, and probably some of it that is still used now, there was like a few problems around it that some people may have experienced, like the side effects with the treatment, with the medication, like how it affected them, like maybe the shaking, they felt shaky, affected their muscle cramps. So what happened there was they were given another tablet to help with the side effect, and then some people may have experienced problems with the side effect tablet as well, so it was like a bit of a cycle going on. But not only that, the medication was like a blocker, what they call a dopamine blocker, because it used to, like with the old medication, like brain fog, what you call like brain fog, affected how you, like your function, like you couldn't function properly. Some people had problems even talking on it, like trying, all sorts of problems. But the thing was, then people were sort of like just didn't want to take the medication. It was like a bit of a battle going on with the doctors and the people that needed the medication. So there's been a bit of a battle going around it. But back then it was like they were sort of like drilled into them. I can imagine you have to take this medication, but now they can't force you to take that medication. They could advise you the risks. So that's the change in it, in the medication. But also there's another change in the medication. Like now they brought in newer medications, like tablets that have less side effects, plus as well how they do it differently, because they've been studying for like years about the medication, how it's affecting people and so forth. So it's like you start off on a low dose of medication, so there's fewer side effects to it. Plus as well, the newer medication, it works differently in other parts of the brain, so it's like it's fighting the illness as well. But with that as well, it stabilizes all the medication does. It stabilizes to help, like with your hallucinate, say like for instance schizophrenia, like whatever you, like you're thinking, your thoughts, hallucinations, delusional thoughts. So it's not, the medication itself isn't a cure for the illness. What happens, you need other treatment alongside your medication to help it, which is your recovery. Other treatment is your recovery. So it enables all the medication does, enables you to have that, because it's like I said, it's a stabilizer. So with the treatment itself, it's like, I don't know, you've got to get to so it's what works for you. There's many different treatments out there. You've got your talking therapies that helps with your thoughts, your hallucinations, your delusional thoughts, But it's the core point, getting to the core problem of what is actually going on. So let's just take, for instance, I don't know, schizophrenia. So you look at the symptoms around schizophrenia, You've got the positive symptoms, like your delusional thoughts, your hallucinations, your behaviour, your believable thoughts, and so forth. And then you've got your negative symptoms, like your emotions, your feelings repressed, depression side of things, lack of motivation, and so forth. So, and all that, the comparison of all that goes into one thing. It's like living like detached. It's more like clinging, and there's a lot of detachment. Detachment is living in the world. You come detached from it. So that's one of the problems. But it's the problems, what I mean by detached and living in the world is the capabilities you've got around that of living in the world, the struggles you have with that. So you go to that point, you go to the problem of what is causing it now, not what happened in the past. It's what is going on now. That is how you start to cope with it, deal with that problem. So, you've got many like different ones. There's ones that work for you. So it's like learning skills. Like you've got like rehabilitation skills, which help you with your recovery. The learning skills, learning to communicate again, and being able to like communicate properly. You may have one-to-one sessions. You go in group therapies, and so forth. It's all about learning to live in the world again that you come detached from. And what it does, it helps you to enable you to cope with that illness. You cope with it, but the main thing is all about having less relapses. With the right medication, the right treatment, which is your recovery, enables you to have less relapses, less and less along the way of recovery till it becomes next to nothing that it relapses. So it's important to find out about the best treatment that is for you to enable you. And as well, it starts with your goals. We've all got goals, and that's where you head to, your goals. So you're heading to something that is positive. An illness isn't all about doom and gloom. There is positives. As long as you're getting that right treatment, you're heading on that right path, that right recovery. You're heading to something that is more positive, and it enables you then. What happens? You get the peer support in the community support from the doctor, like the peer support. And then you've got support of your family, friends around you. All that helps you with your recovery. You start to become more independent with it all. You've got them coping skills there. So you're heading to something that is positive. Like I said, an illness, you can live a normal life. You can recover. People have, I've recovered. People have been on their recovery and got their goals that they want, and they've achieved them. So, there is hope with an illness. It's not all doom and gloom. So it's all, like I said, it's all about getting the right treatment. What's best, what works for you that enables you to get to that point. So that's why I wanted to do the video, because it's very important, because, by just recover. It's a big achievement. By doing so, it's a big achievement getting that far. And eventually you start to learn yourself, you start to do it yourself, and that's even more of achievement. So I hope you enjoyed the video. I hope it was some help, and take care everybody. Give us a like.